Well, I would like to ask you both permission to use this video for educational purpose on the internet.
Yes.
Tell me first about your symptoms now. What is bothering you now? How is the pain?
Pain hurts.
Mm-hmm.
I can bend over, but to get back up, I have to go real slow. Because if you go fast, it tweaks it, something happens.
Yeah.
And then all of a sudden my back just goes into spasms.
1 to 10, how bad is the pain? When
It shoots to a 9.
9.
It'll go from a 5 straight to a 9.
How long has it been like this? How many years? Let your brain help you here. How long has he been suffering like this?
A long time. Over 15 years.
Over 15 years.
So it's about 20,
Yeah,
25
20
years.
So it comes back and forth and it hit you, and in this time frame you have seen lots of doctors, lots of even surgeons, right?
Yep.
Okay. Now, tell me about, in short, what those doctors, how did it start? How the treatment did start with you? What did we start doing for you? We as professionals, okay.
I went to one pain management place in Sartell. They took pictures, x-rays and stuff like this. And then they gave me, prescription, Percocets to start with. And then they did the injections into my spine. I went through
many injections.
Many of, and they said to always wait 2 weeks and you should start feeling a difference. Never felt difference. It never took, whatever. So I told them that's when they put me on Percocets at a high dose, and that seemed to take the pain away. Was on that, still on that.
Yeah. This process has been going on for 10 years or more, so 10 plus years. That you go from to pain management, you get some treatment, and it just goes back and forth, and the problem just doesn't go away.
Right.
Okay.
They just ask me, how am I doing?
Yeah.
What's your pain level at?
One of the problem is that, I'm going to turn around and look at the MRI with you. If you look at your MRI, in a initial look at that, it doesn't look bad. If I wasn't, a specialist, I would just look at that. I would say this is up, down, front, back, bone disc, bone disc. Yeah, the lower disc has a little lower white in it, meaning it has a little less fluid in it. Fluid for a disc is like an air for a tire, but not super bad. But me as a specialist, I say, symptoms, your symptom correspond to that level. Let's look more carefully here. And even in this picture, if I go around here, right, one picture in one slide, I see a white thing there that doesn't belong there. Specialist knows we call that a pars defect. That part of the bone is missing. In a situation like that, you see, there's only one picture that you see that. So it's so easy to miss. But the problem is here, this picture was 11 years ago. This is actually 2011. This is almost 10 years. This is the picture from December 16 of 2011. Okay? So
they've known since then.
The thing is that you see that only in one picture. So this is a problem. Even, the doctors, if you don't do what I'm doing, and if you don't correlate the pictures with the patient, you can miss that. That is nothing unusual. But that's where the Inspired Spine protocols comes in. In your situation, we would always get a CT. You never got a CT. In 10 years, 20 years, you never got a CT. You cannot miss that in a CT. These pictures, this pars defect, it is like day and night on a CT, and that is what the protocols come in. That if you don't get the answer, you don't just stop at one point that, MRI, nothing wrong, go away, go back and forth, get the medication, get the Percocet, let me dry needle you, and so on and so forth. You put a protocol in place for difficult cases, because if it was easy, that would be fixed
a long time ago.
A long time ago. So this is what we are going to do now. And you got actually finally after 15 years x-rays that shows that your spine is moving forward and backward. You have a L5S1 spondylolisthesis, which is very common with the pars defect. So this is a traditional diagnosis. And how was the last 10 years of your life with this problem?
It stopped me from doing everything. I can't do anything anymore. Being a mechanic, I can't even work on cars. The only thing I can do now is brakes.
Yeah.
That's it. It has to be a sitting position.
Yeah.
Nothing being standing up and bent over.
And makes sense that
It's
it makes sense because when you are missing that part, when you bend forward, that put more stress and bone moves the wrong way and it can be very painful.
Yes.
Yeah.
Yes. And it causes way.
So finally, somebody but recently diagnosed the problem finally after 15 years, which I think if the proper protocols are in place, that should be a 1 to 2 weeks kind of investigation to find out about that. Meaning that you come with the proper symptoms, MRI shows something, even if you don't see that area, it's something wrong there, but you have the symptom corresponding to that, but your level of pain doesn't correspond to how bad this is. The next step, get a CAT scan per our protocol.
Which no one has.
And then on top of that, if that doesn't give you the answer, then we have other thing leveled that we go step by step. That is why we are able to investigate and find out things that people are told is nothing wrong, go away. And we found out what the problem is because it is not just a feeling, it's a protocol. Now, but finally somebody found out what's going on. So without saying any names, so what did that person, the surgeon offer you for surgery?
I'm pretty much stuck between a hard place and a rock.
Yeah,
he says that I need to get my weight down between 290 and 250 for them to do the surgery to go
because they want to open up your belly.
Yep.
And then they want to do what we call anterior lumbar interbody fusion, OLLIF, where we cut open the belly, push the organs to the side, go to the front of the disc, they get the bad disc out, put a spacer in, and then we still, most of the time, we turn you over, open you up from the back, and put screws in the back. First of all, how long did they tell you that surgery will take them to do?
8 hours.
8 hours.
Is that what they said?
Yeah, well.
I know it was for the hernia.
Yeah.
That it was going to be 8 hours, but I didn't hear how long for the back because he said
no. Going from the front and back, it can take that long.
Okay.
Going from the front and back, the opening up from the front. Obviously, they will spend a little more time to correct if they can the hernia as well, but they didn't say they are going to do that, right? They said you have to lose weight before they can even do that. So they said this is what you need.
That for years too.
Yeah. They say this is what you need, but we cannot do that unless you lose so much weight, that much or that much weight.
If you can't exercise
or do
because of his
anything.
back.
So do you think is realistic for you to, first of all, you have pain, you cannot exercise, and then it's sort of catch 22. So in a way, everybody knows you need help, but they put the ball in your court. They make you responsible for, doing something that is almost, for most of my patients are telling me, it's impossible. How am I going to lose weight and you said you even eat only once a day and so on, but these are important factors here that one has to be fixed before the other have to be fixed, but the other have to be fixed before the first one have to be fixed.
That's what everybody keeps telling me.
Yeah. Well, you don't have to look no more because first of all, we are going to get a CAT scan, even though we know you have that, but that's part of our protocol. We will get the CAT scan. We see exactly how much bone and where is missing. We will get the full physical therapy in place, strengthen strategic muscle that we will save, contrary to open surgery that kills all those muscles. We will keep those muscles in place. And after that, literally, if your symptoms are still persisting, which most likely they will, now you have better, stronger muscle, we will go and fix the problem for you. And our surgery is not an 8-hour surgery. I don't go through the belly, and we don't fillet your back. And traditionally, we have been doing that surgery in about an hour or less. Okay? So, and that sort of, because we don't cause too much damage, recovery is as well much faster. Just about less than a month ago, I did that surgery on somebody who was significantly bigger than you are. Significantly bigger than you are. That person was 500 pounds, and didn't need that surgery for one level. He didn't need that for 4 levels. And we did that surgery in 2 hours in the university and sent the patient home 2 days later. Okay, so the new technology, and this is has nothing to do with my personal skills, it has to do that we use the highest technology that's available here to make a big surgery small surgery. So, certainly losing weight would be a good thing for you, but this is not a requirement. We made a study. We can show, based on data, that we can perform the same safe surgery in your BMI than somebody who was like 200 pounds less than you are. Okay, we could do or based on data, we can do that. And I think that is why it's important to be able to put the patient in a protocol, not just stop at one level and then repeat the same thing, pain medication, massage, and then another MRI and so on, but not go to the next level, okay? What are you looking forward to if once we fix you? What are the things you wish you could do and you cannot do?
Go back to working on cars, be able to bend over and pick something up, be able to go in the store and buy the big bag of dog food and carry it out myself instead of my girl have to carry it. She carries everything. People look at me, it's like, I can't be doing this.
Yeah.
She has to.
Yeah.
So she's stronger for it.
Then you have to promise me once you are fixed, you send me a picture of you doing that. And she's looking at you. Okay? Okay.
That's not a problem.
Okay. Well, thank you so much for the interview. I appreciate it.